This presentation is for patients who have jaw joint discomfort. The purpose is to show some of the anatomical issues that will help you rest your joint. The joint has two specific movements, one of which it finds difficult and the other easy. If you can stay within the easy movements, then your jaw joint has more chance to be comfortable and to heal. The jaw does these two things. It rotates, that is, it swivels, and then it slides. And both these movements move fluidly one into another. The rotating movement is easy for your jaw joint because it doesn't require movement of the complex anatomy within the joint, whereas the sliding movement has more problems. So if you limit your opening and your side-to-side movements, then you're staying within the easy rotation movements and your jaw joint will be more comfortable and will have a chance to heal. So here's a close-up view of the anatomy of the jaw joint. The green area is where the bone is. The bone is covered by a thin layer of cartilage which protects the bone. It sits within an enclosed capsule, which is fluid-filled space. In the middle of this area is the important structure, which has many names, but we're going to call it the cap. It's also called a meniscus or disc. I'd like you to think about this cap as if it were a real cap that has to stay in position on a head and not become dislodged as the jaw joint moves. For dislodgement leads to the cartilage being crushed or obstructing free movement of the jaw joint. So here's normal anatomy. The cap is staying in its position, it's allowing the jaw to rotate and to slide forward without obstruction. We're going to see some other jaw joints, and each of these has a different problem. In this jaw joint you can see that the cartilage cap is sliding out and in from its position, which the patient would perceive as clicking and minor obstruction. Clearly this is going to cause progressive injury and an increase in the probability of degeneration over time. This next joint similarly has cartilage which is less well held in its correct position, and the cartilage pops in and out of its correct position, which the patient would perceive as a clunking sound, and sometimes the cartilage cap gets stuck in a forward position, obstructing the jaw from opening until it pops back in. Now if it remained stuck in its anterior position, the cap remains stuck on the forehead, then the jaw could not open very wide without extreme pain. However, if it pops back into its correct position, then the jaw can again open. But each time, of course, this cartilage gets injured with an increased chance of wear and tear degeneration over time. Wear and tear eventually causes damage to the cartilage or the bones of either side of the joint. In this case, the damage is such that there is a hole in the cartilage cap. Inevitably, the bones are rubbing against each other. We'd be subjected to increased wear. So, progressive cartilage injury leads to osteoarthritis, wear and tear in the jaw joint. The bones can eventually become flattened, be limited in their range of movement, and this would be manifest as chronic pain. Progressively, the anatomy of the jaw joint is lost. The cartilage may disintegrate entirely, and you will have direct bone-to-bone contact, which will be felt as a gritty feeling when moving the jaw. Well, I hope that's helpful. I look forward to your questions.